And welcome back. Today is a very special episode for our channel because today's episode is just for the guys. Anyone can listen in, but this one's for the guys because we're talking about the prostate gland and its impact on bladder function, common prostate disorders. I think you'll find it very interesting. Being informed gives you choice. So let's dive in. You know, now that I think about it, ladies, if you're listening to this, don't stop listening, because you know what gets guys to go to their doctor? Their wives get them to go to the doctor. They don't want to go. They don't think about it. They got other things on their mind. I remember when I was a medical student, I did a little clerkship at the VA in Northern California, and I was taking care of almost all men during those weeks of my medical school education. And it really solidified my decision to pursue a career in women's health, because a lot of the guys, they just didn't know what was going on with them. They would have multiple surgical scars on their abdomen. I'd say, well, you didn't mention that you had any surgery. What are all these surgical scars from? They'd say, oh, I don't know. They took something. So it took me about 3 or 4 days, and I realized the first question you ask is this your wife in the waiting room? Go get her. Because she knows your history, she knows what meds you're taking. She's going to be the one that gets you into the care you need. And you know what? For guys, with regard to prostate health, that's super important because the organ wasn't designed particularly well. It was a bit of an off day, I think, and it malfunctions reliably. If you live long enough, you're going to have a prostate problem. They say any man lives long enough, he will get prostate cancer eventually. Now, fortunately, a lot of those are indolent. They don't kill you, but nonetheless, some do. So being aware of what the prostate is and what can go wrong with it, and of course, we're going to talk about how it affects bladder function. This all matters. And so if you're having symptoms, maybe this will be your wifely inspiration that you need to make an appointment with your primary care doctor, to make an appointment with a urologist, whatever. So let's take a little look at the anatomy, shall we? The big circle you see on your screen, well, that's the bladder. And those two little dimples you see kind of in the middle of the screen, that is where the ureters enter the bladder. The ureters are those yellow structures towards the top of the screen. They bring urine from the kidney to the bladder. So if you've ever had a kidney stone, the ridiculous pain you feel is while that stone's passing through those very sensitive ureters, winding up in the bladder, and then you got to get it the rest of the way out through the urethra. Also uncomfortable. If you've had one, you know. Anyway, the little walnut-sized, walnut-shaped deal just below the bladder, that is the prostate gland. And you can see the urethra passes right through the middle of it. What could possibly go wrong? Well, you may have guessed, a lot can go wrong. And we're going to talk about the 3 common disorders that men have to deal with when it comes to prostate health. Disorder number 1, benign prostatic hyperplasia. Disorder number 2, prostate cancer. And disorder number 3, something called prostatitis. If anyone asks you, decline. You don't want that. We're going to talk about each of these in turn. So let's take a look at the first disorder, benign prostatic hyperplasia. Now, can you guess which one of these is abnormal? I'll bet you can, right? Because abnormal things tend to look abnormal. The bladder and prostate and urethra on the left, happy camper, right? Looks normal, looks healthy, looks good, everything's functioning, hopefully. And on the other side of the screen, we see unhappy patient because this patient's prostate is hugely enlarged. And what happens as it enlarges? Well, it doesn't just push outwards, it also pushes inwards, compressing the urethra. So the bladder doesn't know that the prostate's compressing the urethra. It still tries to empty the way the bladder will, the way the bladder should. But now the urethra is constricted, if you will, or I should say compressed by this abnormally large, firm prostate gland, and it makes it difficult to get urine from the bladder out of the body. You see, the bladder can only generate so much pressure when it contracts, when it's time to urinate. And if that pressure isn't enough to generate a normal urine stream, well, you wind up having a hard time establishing a urine stream, or maybe it starts and stops and just dribbles, or maybe it's just weak and you can't empty your bladder completely, gigantic pain in the neck. And for a lot of guys, that gets them into the doctor's office. But as you will see over the course of this video, not all things that interfere with how often you urinate, or how well you empty your bladder, or how rapidly you can empty your bladder. Not all things that do that are benign prostatic hyperplasia, right? There's a lot of other diagnoses. In fact, each of the disorders we're talking today does the same thing. So frequent urination, urgent urination, weak urine stream, interrupted urine stream is not a diagnosis. Those are symptoms. You got to talk to your doctor and find out which disorder you have. Get a diagnosis, because the treatment is different, radically different. And getting the right treatment is going to get you better quicker. But there is some good news. This is not going to kill you. This is a benign diagnosis. It's benign prostatic hyperplasia. And so, it's a terrible quality of life issue. It's super duper common, and it is also treatable. That treatment may include medications to help sort of loosen up the pressure on the urethra, or it may involve surgical procedures to help reduce the volume of the prostate. And although the latter certainly wouldn't be my first choice, it can be extremely effective and relieve these symptoms of not being able to urinate properly. Disorder number 2, prostate cancer. Now, prostate cancer is a whole different kettle of fish. While benign prostatic hyperplasia tends to globally enlarge the prostate cancer tends to be more focal. And as you may be well aware, if you get your annual checkup, which you should be doing, your doctor likely will do a rectal exam and try and feel the prostate through the top wall of the rectum, and see if it's a normal size. If it is enlarged, is it enlarged globally, or is it nodular? This might make them more suspicious that there is a malignancy present, and could, with imaging, possibly warrant a biopsy. That biopsy is generally done in the office and through the rectal wall, believe it or not. I know that doesn't sound great, but you know what? If your doctor's concerned that you may have a cancer, then it is a small price to pay to get the diagnosis made early, so that the right treatment can be implemented as quickly as possible. But whether the prostate is globally enlarged or whether it's focally enlarged, as is the case with early prostate cancer, you can see how that tumor on the right side of your screen can compress the urethra in much the same way that benign prostatic hyperplasia compresses the urethra, and in doing so can generate the same kind of bothersome symptoms of weaker urine stream, not being able to empty the bladder completely, having to go more often. And so those symptoms, those urinary symptoms, are not enough to make the diagnosis. You gotta have a doctor's diagnosis. Well, good heavens, what else could possibly go wrong with this ridiculous little organ? Well, there is another thing, and it's not uncommon either: prostatitis. Now, what you're looking at on the left side of the screen is normal, as it has been for the last couple of slides. And on the right side of the screen, we see the inflamed prostate. So the itis just means inflammation. So prostatitis means prostate inflammation. Now, there's two different kinds of prostatitis you need to be aware of. The first is a bacterial prostatitis. That is a legit infection, and it's treated generally with a course of antibiotics, sometimes quite a prolonged course of antibiotics, but it can clear it up. There's a whole bunch of different kinds of bacteria that can cause this, but it is treatable, and it's treatable with medication, and it reliably gets better. Now, the second type of prostatitis is something called non-bacterial prostatitis, and that may not even be a prostate disorder. The hallmark symptom of a so-called non-bacterial prostatitis is pain, and a lot of those patients may have male pelvic pain from the non-relaxing pelvic floor, the short pelvic floor, the tight pelvic floor. I have a whole separate video on this. Women are affected by it, men are affected by it. It's horribly bothersome, and it is poorly diagnosed because I think in large part, it's poorly understood, especially at the level of the primary care physician. Nonetheless, the inflamed prostate that's inflamed because it has a legit bacterial infection, again, can become swollen and compress the urethra and produce those bothersome abnormal symptoms of having to urinate too often or urinate in a hurry or not empty your bladder completely or have a weak urine stream. But if you do have a pelvic pain diagnosis that has been diagnosed as non-bacterial prostatitis, it could be that you have a tight, non-relaxing pelvic floor. And you know what that can produce? Frequent urination, urgency to urinate, weak urine stream that starts, stops, and dribbles. So you just don't know because you have these symptoms. There's a lot of different things going on that could be contributing, and seeing a urologist is probably the most important thing you can do to begin sorting it out. Well, what do you think? Has that been interesting for you? I hope it has. I hope it's been informative and helpful. If so, like this video. It helps us reach more people. You can subscribe to our channel. That also helps us. And leave a comment below if you have specific questions. I look at every single comment and I will answer them. We'll be bringing you more content soon. So keep checking back with us. Talk to you soon. Bye-bye.